9 popular medications that can trigger rapid dementia. Every 66 seconds, another senior in this country is diagnosed with dementia. By the time this video concludes, an additional 20 families will have received this devastating news. For some of these individuals, the cause of their cognitive decline is not simply aging, but rather a seemingly innocuous bottle on their bathroom shelf, a medication they were assured was safe. Dr. John Myers, with 15 years of medical practice, has witnessed this all too frequently. He has observed individuals, once sharp and vibrant, begin to falter, their memories fading, appointments missed, and familiar routes becoming confusing. This decline, often dismissed as a natural part of aging, was, in reality, a consequence of prescribed medications, ones rarely questioned because they came from a doctor and were dispensed by a pharmacist. Emerging research consistently points to a specific class of everyday drugs capable of significantly impairing memory and learning within a single year, often without the user being aware of the damage being done. Dr. Myers aims to illuminate this critical issue by detailing 9 medications most strongly linked to rapid memory loss, ranking them from those most easily overlooked to the most destructive. He specifically highlights medication number 3, a drug prescribed to millions of seniors for seemingly harmless conditions, which may be silently shrinking the brain's memory centers without any warning signs. Before delving into the list, Dr. Myers invites viewers to share their age and current medications in the comments, as this information helps shape his future content. Starting at number 9 is diphenhydramine, widely recognized by its common brand name, Benadryl. This readily available medication, often found in nearly every American medicine cabinet, is a go-to for sleep, allergy relief, and soothing cold symptoms. Its low cost and over-the-counter availability lead many to believe it is harmless. However, within the brain, diphenhydramine acts as an anticholinergic, a class of drugs that blocks acetylcholine. Acetylcholine is a vital neurotransmitter responsible for forming new memories and maintaining alertness. As we age, our brains produce less of this crucial chemical, making them more vulnerable to its blockage. The hippocampus, the brain's memory-forming center, is particularly affected. Dr. Myers has seen patients experience gradual cognitive fog after years of nightly antihistamine use, never connecting it to the readily accessible pill. Research supports this observation, with a 2023 study in the Journal of Geriatric Cognitive Health revealing a 54% increased risk of dementia in older adults who regularly used anticholinergic drugs compared to those who did not. This means something as common as Benadryl, often treated like candy, can more than double the normal risk of dementia. Dr. Myers advises viewers to carefully examine labels on sleep aids, PM medications, and allergy relief products, as these often contain diphenhydramine under different names. For allergy sufferers, safer alternatives like loratadine, Claritin, exist that do not cross into the brain as readily. Crucially, never stop a medication without consulting a doctor, but do question the assumption that over-the-counter status equates to memory safety. Moving to number 8, we find proton pump inhibitors, PPIs. Medications like omeprazole, Prilosec, and esomeprazole, Nexium, that are celebrated for their relief of heartburn and reflux. While these drugs effectively reduce stomach acid, often leading to long-term reliance due to symptom rebound upon cessation, they come with a significant cost to brain health. Stomach acid is essential for nutrient absorption, particularly vitamin B12, which is vital for nerve health. Reduced acid production can lead to deficiencies in B12, magnesium, and calcium, all crucial for neuronal function. This nutrient starvation can manifest as confusion and memory lapses that mimic early Alzheimer's. A large 2016 study in JAMA Neurology found that regular PPI users over 75 had a 44% higher risk of dementia. Furthermore, PPIs have been linked to increased levels of amyloid beta, a protein implicated in Alzheimer's disease. Dr. Myers suggests that individuals on daily PPIs discuss tapering down with their doctor, potentially switching to H2 blockers like famotidine, Pepcid, or exploring natural remedies like deglycyrrhizinated licorice. The key is to use the lowest effective dose for the shortest duration, rather than a permanent habit. At number 7 is oxybutynin, sold as ditropan, a medication prescribed for overactive bladder and the urgent need to urinate, conditions that can significantly impact daily life and cause considerable embarrassment. While the relief provided is real, oxybutynin, like Benadryl, is an anticholinergic that blocks acetylcholine and readily crosses into the brain, interfering with memory formation. This makes it particularly dangerous for older adults, especially with prolonged use. A 2019 study in the British Medical Journal found a 49% higher risk of dementia in individuals over 65 who took strong anticholinergics like oxybutynin for over a year. Alarmingly, many patients were not warned of these cognitive risks, with the resulting memory fog being attributed to age. For those experiencing memory decline while taking oxybutynin, Dr. Myers emphasizes that there is no need to sacrifice bladder control for cognitive function. Newer medications like mirabegron, Myrbetriq, offer similar bladder relief through different mechanisms without impacting acetylcholine and thus carrying far less risk to cognitive health. Number 6 might be a surprise, as it is one of the most widely prescribed drug classes globally: statins. Medications like simvastatin, Zocor, and atorvastatin, Lipitor, are crucial for lowering cholesterol and reducing the risk of heart attacks and strokes, and thus have a rightful place in many people's health regimens. However, the often overlooked aspect is cholesterol's vital role in brain function. The brain is composed of approximately 60% fat and utilizes cholesterol for myelin sheath formation, the insulation that ensures efficient nerve signal transmission. Aggressively lowering cholesterol with potent statins can deplete the brain of this essential building block. Statins that readily cross into brain tissue pose the greatest risk. A 2023 study in Frontiers in Aging Neuroscience indicated a 26% higher rate of mild cognitive impairment in adults over 70 who had been on statins for over 3 years, with higher doses correlating with steeper cognitive decline. Some patients report disturbing memory lapses, forgotten conversations, and unfamiliarity with familiar routes. It's important to note that not all statins affect the brain equally. Pravastatin and rosuvastatin are less likely to penetrate brain tissue and are generally considered safer for cognitive health. If statin use is accompanied by cognitive changes, a conversation with a doctor about dose reduction or switching to a different statin is recommended, rather than discontinuing a potentially life-saving medication without professional guidance. A brief pause for audience engagement. If this information resonates, a simple tap of the like button helps this vital message reach more seniors. Viewers are also encouraged to share the number of prescriptions they are currently taking, as Dr. Myers reads every comment. Returning to the countdown, at number 5 are benzodiazepines, a class of drugs including lorazepam, Ativan, diazepam, Valium, and alprazolam, Xanax, frequently prescribed for anxiety and sleep. These medications work by enhancing GABA, the brain's inhibitory neurotransmitter, to calm an overstimulated nervous system. While initially providing relief, long-term use can have serious consequences. A 2022 study in the British Medical Journal followed over 8,000 seniors for 6 years and found a 51% higher risk of Alzheimer's disease in those using benzodiazepines for more than 3 months. Longer-acting benzodiazepines are particularly problematic as they accumulate in fatty tissues, including the brain. The cumulative effect is a slow chemical sedation of the brain, hindering learning and flexibility. Many users report a flatness, a feeling of moving through a fog, and a sense of not being themselves. The withdrawal from these drugs can be severe, with anxiety and insomnia returning with greater intensity, creating a dangerous cycle where the pill feels essential precisely when it is causing the most harm. Therefore, a critical rule is to never abruptly stop benzodiazepines after a few weeks of use, as this can be life-threatening. Gradual tapering under medical supervision is essential. Safer alternatives for anxiety include buspirone, which does not cause sedation or cognitive clouding, and specific forms of talk therapy for insomnia and anxiety that promote calm without cognitive impairment. At number 4 is amitriptyline, sold as Elavil, an older antidepressant prescribed for a variety of conditions, including nerve pain, sleep disturbances, and even migraine prevention. Its versatility has led to its widespread and often unnoticed use. However, amitriptyline is a potent anticholinergic, meaning it significantly blocks acetylcholine, the very neurotransmitter essential for neuronal communication and memory formation. With long-term use, the impact on memory transitions from a rare side effect to an expected outcome. A large 2015 study in JAMA Internal Medicine found that individuals aged 65 and older with the highest cumulative dose of anticholinergic drugs like amitriptyline over a decade had a 54% greater chance of developing dementia. Many were unaware of this potential side effect, attributing their memory and concentration issues to aging. Even a low nightly dose taken for years can subtly erode cognitive function without apparent symptoms until the loss is significant. For those taking amitriptyline, a conversation with their doctor is warranted. Safer alternatives exist for nerve pain, for example, duloxetine, gabapentin, for sleep, for example, melatonin, low-dose doxepin, and for mood, for example, sertraline, escitalopram, which are generally considered much safer for long-term brain health. The medication to watch for, number 3 on the list, is paroxetine, known by the brand name Paxil. It is a commonly prescribed SSRI antidepressant for depression and anxiety, often perceived as a gentler option than older psychiatric medications. However, paroxetine stands out among SSRIs for its strong anticholinergic activity, a characteristic that sets it apart from siblings like sertraline and escitalopram. This potent anticholinergic effect directly interferes with the acetylcholine system, the same pathway targeted by other drugs on this list. A comprehensive 2021 review in Frontiers in Psychiatry examining older adults on various SSRIs found that paroxetine users experienced measurable declines in short-term memory, word recall, and attention within the first 12 months, showing a 30% higher likelihood of early cognitive impairment compared to those on other antidepressants. The irony is that a drug intended to stabilize the mind can, over time, degrade the very clarity it aims to protect. The American Geriatric Society has placed paroxetine on the Beers list, a formal compilation of drugs considered risky for seniors, precisely for these reasons. Individuals taking paroxetine are strongly encouraged to discuss switching to safer SSRIs like sertraline or escitalopram with their doctor. Supplementing with B vitamins, particularly B12 and B6, can also support mood naturally alongside this medication change. At number 2, a medication so quietly prescribed that many users are unaware of its true nature, are antipsychotics. This category is particularly disturbing to Dr. Myers because so many individuals taking these drugs never consented to an antipsychotic. Quetiapine, Seroquel, risperidone, Risperdal, and olanzapine, Zyprexa, were originally developed and approved for severe psychiatric conditions like schizophrenia and bipolar disorder. However, they are now frequently prescribed off-label for older adults for issues such as sleep problems, mild restlessness, or agitation associated with dementia. These powerful medications, intended for serious illness, are now being used in homes and nursing facilities for seniors who are simply confused, restless, or difficult for busy staff to manage. The consequences are severe. A 2022 study in Lancet Healthy Longevity followed over 25,000 older adults and found that those receiving antipsychotics for behavioral symptoms were 71% more likely to experience worsening cognitive decline within a year, even without a prior dementia diagnosis. These drugs also increase the risk of stroke, sudden cardiac death, and profound sedation leading to falls and hospitalization. They function by suppressing dopamine, a neurotransmitter crucial for mood, focus, planning, and memory. A significant reduction in dopamine levels can lead to a slowed, unresponsive brain, making individuals appear dull, flat, and detached to the grief of their families who see a person still present but seemingly absent. If you or a loved one is on an antipsychotic, Dr. Myers urges a direct question to the prescribing physician. Why was this medication initiated, and is it truly necessary, or is it for convenience? Many behavioral symptoms can be managed through consistent routines, reduced stimulation, addressing hidden pain, and optimizing light and sleep. When medication is unavoidable, the lowest effective dose for the shortest duration is paramount. The failure to inform families about the cognitive effects of these drugs often leads to the mistaken belief that decline is solely due to aging, when in fact it is chemically induced. The most significant hidden driver of memory loss on this entire list, and therefore number one, is not a single drug but a phenomenon: anticholinergic polypharmacy. This is the danger that is rarely named, and it is likely a primary cause of drug-induced memory loss in older adults. While one might expect a singular villain, the true culprit is the subtle, cumulative effect of taking multiple anticholinergic medications simultaneously, without anyone tallying the total burden on the brain. Polypharmacy simply means using many medications, and anticholinergic burden refers to the combined impact of these drugs blocking the critical memory chemical acetylcholine. Consider a common scenario. A senior takes Benadryl nightly for sleep, oxybutynin daily for bladder issues, and amitriptyline for nerve pain. Individually, each might cause a minor, barely perceptible cognitive dip. However, taken together, their effects compound, rapidly increasing the load on the brain. A 2022 study in Age and Aging tracked over 280,000 older adults and found that those with the highest anticholinergic burden had a staggering 120% higher risk of dementia within 10 years, more than double the normal rate. Alarmingly, the vast majority were unaware they were even taking anticholinergic drugs, as no one had explained it to them. When acetylcholine is blocked from multiple sources, neurons can begin to wither from disuse, connections can shrink, and the brain can settle into a quiet, underpowered state that closely resembles Alzheimer's disease on diagnostic tests. The hopeful aspect, and the reason for this video, is that drug-induced cognitive decline is often reversible if caught early. By lifting the anticholinergic burden, many individuals can regain their clarity, energy, and memory within weeks or months. The brain's resilience is remarkable, but it requires removing the harmful influences. The solution does not involve a miracle, but a meticulous medication review. Sitting down with a doctor or pharmacist to examine every prescription, over-the-counter product, and supplement, and calculating the total anticholinergic load is crucial. Simple scoring tools exist for this purpose. Once problematic drugs are identified, they can be tapered off, replaced with safer alternatives, and the brain can be given the opportunity to recover. This is the most preventable threat to the aging mind on this list, and it is precisely why it ranks number one. Dr. Myers concludes by asking viewers which of these 9 medications are currently in their cabinets and if they have noticed any brain fog or forgetfulness after starting new medications. He urges them to share their experiences and to commit to requesting a medication review this week, as their response could be vital for someone else. Finally, he hints at his next video, which will explore warning signs that can be observed in fingernails, indicating potential issues with kidneys, blood, or the nervous system, often years before other symptoms manifest. He encourages viewers to stay sharp and tune in for that informative discussion.